This week on Health Across the Islands, 2 dead from Cyclosporiasis. Cyclosporiasis outbreak in Cancun hotels. Caribbean health warnings raise concerns. Surge in biting mosquitoes across the Cayman Islands. Health screenings to be offered at CPL. This when we return on this week's episode of Health Across the Islands. Thank you for making it Health Across the Islands, your Caribbean weekly health news briefing. I'm your host, Natasha Robinson. A major cyclosporiasis outbreak in Michigan has now claimed 2 lives as the number of reported infections continue to climb. The Michigan Department of Health and Human Services is reporting 12,485 cases, 279 hospitalizations, along with the 2 deaths as of August 6. These are part of approximately 23,000 confirmed and probable cases of cyclosporiasis that have been reported across 47 U.S. states. According to health officials, both people who died had significant underlying health conditions that may have been worsened by the infection and the dehydration it causes. Up to this point, deaths from cyclosporiasis have been extremely uncommon. Health officials are still investigating the source of the outbreak, with lettuce and other salad greens being considered as potential, although no specific produce item, grower, or supplier has been confirmed as the cause. The 2 people who died became ill before a voluntary recall of iceberg lettuce announced by the U.S. FDA on July 17. Cyclosporiasis is an intestinal infection caused by the parasite Cyclospora cayetanoensis. The illness is generally not considered life-threatening, but it can cause prolonged watery diarrhea, abdominal pain, nausea, loss of appetite, fatigue, and weight loss. So far in the Caribbean, imported cases have been identified in Puerto Rico and the Cayman Islands, and at this point, Mexican health authorities are investigating 33 confirmed cases and inspecting hotels in the popular tourist destination of Cancun. Mexico's Ministry of Health says investigators are working to identify possible sources of infection, trace food products, and determine whether any contaminated products or establishments in Mexico could be connected to the cases. The Federal Commission for the Protection Against Sanitary Risks, known as COFEPRIS, inspected 16 hotels in Quintana Roo after British authorities notified Mexico about cases involving travelers who stayed in the Mexican Riviera Maya region. These inspections were completed on August 4, but laboratory testing of the samples is still underway as they try to establish the source of the infections. Importantly, Mexican authorities have not confirmed that the hotels or Mexican food products are the source of the outbreak, but they're still encouraging that fruits and vegetables should be properly washed and disinfected, while safe drinking water and good hand hygiene remain important measures for reducing the risk of intestinal infections. Health authorities and regional climate health monitoring agencies are continuing to warn of environmental conditions that could affect health across parts of the Caribbean. Recent Caribbean heat health monitoring has identified areas at increased risk of moderately severe and severe heat, with conditions varying across countries and territories. The latest Caribbean Heat Health Early Alert Bulletin, valid for August 5 through to August 11, identifies an increased chance of moderately severe to severe heat across parts of the Caribbean, including the Bahamas, Jamaica, Cayman Islands, Dominican Republic, Guyana, and Suriname. The bulletin warns that high temperatures can increase heat stress and encourage people to stay hydrated during periods of excessive heat and limit strenuous outdoor activity during the hottest parts of the day. Vulnerable population groups, including the elderly, children, and those with pre-existing health conditions, are being asked to consult a doctor if not feeling well. A surge in biting mosquitoes across parts of Grand Cayman has prompted the Mosquito Research and Control Unit, MRCU, to intensify control operations. The MRCU says mosquito numbers remain above what is considered acceptable levels in several areas of the island, with surveillance showing a significant increase in activity driven largely by tidal flooding. High tides have pushed water into large areas of low-lying wetlands, including areas that can remain dry for extended period. The flooding creates conditions that allow large numbers of dormant mosquito eggs to hatch simultaneously. The scale of the increase has been significant, with trapped data recording a daily total of more than 9,000 mosquitoes in June, followed by another spike in July when more than 5,000 mosquitoes were recorded in a single day. The MRCU says its team are carrying out extensive surveillance and control operations using trap data alongside field inspections, biting activity, tidal conditions, rainfall, and weather forecasts to determine where intervention is needed. While the current levels are high, the MRCU says they are not unprecedented, as the 2023 average was higher. Caribbean Premier League (CPL) fans will have access to free health screenings this season as organizers expand the tournament's community health initiatives across the region. The screenings will be available at all 8 CPL host venues, bringing basic health services directly to fans attending these matches. The program will offer screening for several important health indicators, including blood pressure, blood glucose, body mass index, urinalysis, and prostate-specific antigen testing. The initiative is being introduced against a backdrop of the Caribbean's growing burden of non-communicable diseases, including hypertension, diabetes, and certain cancers, with the goal of reaching people who may not routinely seek preventative health services. So if you are planning on attending a CPL match, please be sure to check for a screening area. These are the stories making up this week's episode of Health Across the Islands. I'm Natasha. See you next week.